been 14 days since my chemo treatment and I'm feeling fine, but today I noticed that my hair is falling out.
Tell us a little bit about when you got chemo.
When I got chemo, I went to a room and they basically gave me a IV and they let it run for about 12 hours.
Did it hurt?
When it went in, it was like a needle.
Well, yeah, that was the IV. Did the chemotherapy itself hurt?
No.
Okay, so if you're making this video so other people that might be afraid of getting chemo or are worried about what it might, entail or whatever, do you have any advice?
Not really. I would just say don't panic because it just makes it worse. And chemo is not something that you should be afraid of because it doesn't really affect you that much as far as I know. Because the only thing it does to me is it makes me cough. And once in a while I probably have like no poo.
Were you afraid when you got your chemo the first time?
I was nervous, to be honest. I didn't know any of the effects of the medicine. I was nervous because I had no idea how this was going to work or play out.
But that didn't last long. After about what do you say, about an hour into it, you realized it was just going to be a really long, boring day.
Pretty much. Really long, boring day just sitting in a room waiting for chemo to be done.
You've got another chemo treatment, and I think it's, let's see, 5 more days?
I think so. It total 21 days and it's my 14th day, so...
Okay, so 7 more days.
Yeah.
7 more days, and that'll be your second chemotherapy treatment.
Yeah.
And so far, like I said, you're 14 days in, and today's the first day you notice you've got a little bit of hair loss, and other than that, you haven't been feeling ill or anything else.
No.
Just a cough.
Yeah, just a cough. It's been a couple of days,
Okay.
And some more of my hair started falling out, and the kids in my Zoom meeting started to notice.
And how did they react?
They noticed my hair falling out, and they're asking me questions, and one said, "I'll make you a wig," and I'm like, "Go ahead." I already got enough hair in the bag to get you started.
Did they ask you any questions?
Like, does it hurt when it falls out? I'm like, no, it doesn't really hurt. It just comes out in a lot.
Does it make you tired?
The chemo effect makes you tired, and it also gives you a cough. But other than that, pretty much just the hair falling out next.
Notice anything different now from a couple of days ago when we first took a video?
Not really, besides more of my hair gone.
Anything you'd like to tell anybody that might be worried about chemotherapy? And anything, because I know when you first heard that you had to have it, you were kind of scared, weren't you?
I was. That's because I didn't know anything about it, but to be honest, it's not that big a deal now that I think about it, because the only effect that it has is it might make you tired, and it just gives you a cough.
Now keep in mind, you've only had one treatment.
Well,
This is your first treatment, so your next treatment, that's Thursday.
this coming Thursday?
Yes.
Okay.
So you might feel a little bit different, after your next treatment, and then after that one, and then after that one, and so. But right now,
as of right now, that's the only thing that I noticed that the effects of chemo so far.
and did they say your hair is going to grow back, right?
Yeah, but it's gonna take a while.
It's gonna take, you'll have to finish chemo before it grows back.
Yeah, I'm gonna have to finish chemo, and it's probably gonna take 6 months.
Okay. Did they say anything about, are they gonna be able to do anything about your face?
Probably not.
And so you're stuck like this,
Probably so.
looking like this.
Most likely.
Well, I mean, aside from the hair thing, you're going to be, you know.
You know what?
It doesn't matter. I've got plenty of paper bags in the back.
I'm not going to wear one of your paper bags, but...
You got to think about other people, man. It's the whole reason we're doing this is because you're thinking about other people. Today before your last trip. Actually, you're not your last trip. You're getting ready. This is your second trip. You got one more after this? I love you. Or two more after this? Two more? Okay, so... Anything to say?
This is going to be my second time going for chemo, and I don't know what else to say.
We'll see you when you get back.
See you when I get back, bud. I had my second chemo treatment a week ago, and the only side effects I have right now is my coughing throat and my hurting arm.
What's wrong with your arm?
It has like a sharp pain in it, and it's probably because of the chemo that they gave me is attacking the cancer in that area, and therefore it's making me hurt because it's attacking my tissue of my organ. I don't know.
So you're beginning to look a lot like Scott Evil.
And how do you say that?
From Austin Powers?
No, I mean, why do you say that?
Because you're beginning to look, your hair's missing.
Oh, yeah, I lost my hair.
You didn't lose all of it.
I lost some of my hair with the last chemo treatment, but it was gone in like the next month or two.
They say you're going to lose any more hair, or are you going to get to keep the hair that you've got?
I'm probably going to lose the rest of my hair if I get another chemo treatment, but I don't honestly know.
And have you given any thought as to what you're going to do when your penis falls off?
I'm pretty sure the side effect is not going to be you lose your wiener. You idiot. Are you trying to make a joke or something?
Yeah.
Good point.
Anything else you'd like to tell anybody else that might be worried about chemo or anything like that?
I would say the only thing that's going to be bad about it is they're going to just put a needle in you. And frankly, most of you probably don't like needles, but other than that, you're pretty much going to be fine. That, and you're going to be stuck in a room for an hour or more. But each time you do it, it should take less time for it to work and get inside the body. So, less time you spending time in the room.
Anything else?
Not that I can think of. I mean, you might have trouble sleeping at night, or you might have a sore throat from coughing a lot and pain in your arm, but that's all I know so far.
How you feeling now?
Well, other than my arm hurting a bit, I'm fine. But I just try to ignore it the best I can, and eventually it'll feel like myself again.
Boogity, boogity, boogity. I know. Okay, so you've had your 3 chemo treatments, and you had some coughing after this third one here. And you actually had coughing with all of them, haven't you?
Yeah. As far as I know, coughing has been a consistent thing throughout the entire chemo thing.
How do you feel?
I also been experiencing some cold chills and numbness of fingers, but that's about it.
The doctor said that was okay, that was not entirely common, but it would go away when you stopped the treatment.
Yeah, when you after the chemo effects wear off, yeah, it would go away.
Seems to be keeping some of your hair.
Yeah, I still got some of my hair. Yay!
Here, turn to the right. Keep going. A little more. There we go. It's almost like you have a mullet.
Yeah.
How's everything else going? How you feeling, like on a day-to-day basis?
On a day-to-day basis, it really depends. Sometimes I have like a sore throat, and that's about it. And sometimes I have like pain when I go bathroom with my butt, but that's about it.
Coughing, anything like that? And you said you had some of that. Have you thrown up any at all?
No, it's just coughing and sore throat. That's about it.
Okay. Anything else you'd like to add for anybody who might be worried about it?
You don't really have to worry about it. I mean, some of the effects, like the numbing finger and the coughing, will go away as soon as the chemo wears off. But don't panic about it because when I first found out that my fingers were numb, I'm like, why is my fingers so numb? And then you guys called and talked to the doctor about it. I'm like, oh, great, chemo.
Yeah. Now, keep in mind too, I'm sure chemo is different for every person out there, and some people have chemo, a lot longer and a stronger dose than what you had. So, what they say, your experience may vary depending upon your particular thing, because I'm pretty sure they tailor this to the individual and what you might have.
Depending on what type of person you are.
Or what kind of cancer you might have as well. So, and your grandpa just had part of his lung removed, actually. We just found out about that. What was it, last week?
Last week?
It was about when the surgery was last week when your grandpa, because he had cancer, he had lung cancer, so.
Okay.
So. But he's doing really good now.
Cool.
And he goes back to the doctor, was it today? Wanda said yes. Did Grandpa go back to the doctor today? Okay. So at any rate, just wanted to make sure. So at any rate.
Sorry about the crazy bird.
You got your family and your bird behind you. You're doing great. We got another trip to the doctor for your fourth one coming up in a couple days, and then we'll check back with you in a week or two and see how that went. All right?
Okay.
All right. Anything else to say, buddy?
I can't really say anything. I mean, all the symptoms that I've been having are kind of weird, and I don't really get or understand how it works, but that's the thing about chemo.
Yep. All right, buddy. Thanks.
You're welcome.
Hey, William, how you doing? You just had your fourth chemo about a week ago. How you feeling, bud?
As of right now, I'm feeling fine, although I've been having cold flashes where my body temperature drops.
It just feels like it's dropping. It's not actually dropping.
Yeah, like I just feel like really cold and I have to wrap myself up in a blanket or something.
I noticed you weren't coughing nearly as much this time as you have been the last 3 times.
No, actually no. I haven't really coughed that much a lot.
Something else that was kind of interesting and we don't know the answer to is you haven't been getting nauseous, and we frequently have heard that, chemotherapy causes you to get nauseous and make it hard for you to keep your food down, but you haven't experienced any nausea like that.
No.
But when you cough a lot, you cough so much that it almost makes you throw up.
True.
So I don't know if that's what they're talking about the nausea or not, but something we might want to look into next time we talk to your doctor.
Yeah, it's where coughing makes me feel nauseous, or whether it's just something else.
Yeah. So, tell me about your fingertips.
Well,
How are they doing?
Actually, my fingertips are feeling numb right now. I don't know why. It's like a month or a week after the chemo thing starts happening, it's like numb.
But they said that would return.
Yeah, when the chemo effects wear off.
Mm-hmm.
So far my fingers are numb and the chemo's still working.
Yeah.
Yay.
I noticed you lost a little hair.
Oh yeah, I lost a little hair and I also grown some back.
You grew some back?
Yeah, I've like probably grown some back and now I'm losing it again.
Okay, so we've got another week or two, and then you're going to go back, and you're not going to do chemo this next time. They're going to do your PET scan, and then you're going to be put on some medication that helps you regrow your white blood cells.
Mm.
I think is what the next call for is.
Yeah, but for some reason I have an allergic reaction to it.
I don't know if you're having an allergic reaction to that or not.
Mm.
You're having an allergic reaction to some of it, but they gave you Benadryl. And I don't remember what it was that you were having a reaction to. But
Yeah.
so, any advice? Anything you'd like to tell anybody about it?
I don't really know. I would say if your fingertips start going numb, don't worry about it. It'll return after the chemo thing wears off. Because when I first experienced it, I'm like, why is my fingertips going numb now?
But we called your doctor. Any symptoms they need to report to their doctor.
Yeah. So call the doctor if you have any symptoms that you need to report. That's the fun thing.
Okay. Well, we'll check back in a couple weeks after you get your PET scan and see how things are going.
Yeah, I don't know how PET scan works.
You've had one before.
Yeah, but I don't remember it that well.
They gave you some sugar stuff, something or other. I don't know.
Like
and
something
then
for the drink.
yeah, something for you to drink, and then they scanned you and they were checking to see where it was getting metabolized most at. I think the hot spots, basically, so they knew where and what was going on. So, at any rate, we shall see.
We shall see indeed.
All right. Thanks, buddy.
You're welcome.
Hey, William, how you doing?
I'm doing fine.
Let's see. It's been about a week since you had your rituximab. That's you've got this last appointment here, and you've got one coming up in about 2 weeks, 2.5 weeks, and I think that's your last treatment. How you feeling?
As far as I know, it's pretty much fine. Still having the coughing problem and the temperature dropping.
The hot and cold, or the cold flashes, rather.
Yeah, the cold flashes where my body drops in temperature.
Well, your body doesn't drop in temperature; it just feels like it does.
Yeah. I don't really know anything that.
I noticed since the last week, since you've had this, and this has nothing to do, I think, with the rituximab, but your hair is starting to come back.
Yeah, I'm not sure if it's the chemo's wearing off, therefore my hair cells are able to grow back, or what. But they said that the hair would grow back in about a month or two.
Yeah. We did your PET scan last time, a week ago, and they said that they didn't find anything. Looks like you're all clear.
So, no cancer cells?
That's what they're saying.
Yay! I don't have to do chemo.
Yep.
Unless it comes back.
Well, just this one next treatment, and that's going to be it. And then we just have to monitor you. So.
I'm sure it doesn't come back, and if it does, we're gonna have to do the whole process again.
Well, something. It depends. You're a transplant patient too, so one of the reasons why you're getting this particular type of cancer, of course, is because you have a transplant, and so.
Yeah, but if it's a transplant, then why didn't it come when I had my transplant rather than now? Sometimes
it takes time.
Good point.
So Sometimes it's a combination of you're on anti-rejection medications, which weaken your immune system, and everybody gets cancer. We just don't know it because our body fights it off.
Yeah.
But when you have a weakened immune system, you can get the cancer the body normally fights off because it's not there. I think they were saying you will get transplant cancer if you get mono, a specific kind. So, but they know how to take care of that. So, it's not real scary, but so you know.
Yeah.
So how you feel?
As of right now, I feel fine.
One more trip, man.
Yay!
Any words of wisdom to anybody?
I would say best of luck, don't panic, and it's not as bad as it may sound, because as far as I know, it's not that bad. But
yeah, you were really lucky though. Keep that in mind too, man. We caught your stuff really early. You were actually having stomach problems.
yeah, I was having stomach pain and side pain, and I was having to sit in the chair. It was getting really bad at one time.
That was unrelated to the cancer. They just happened to find the cancer while they were trying to figure out while that other stuff was going on.
Yeah.
Which was like your grandpa, who just had lung cancer surgery because he was climbing in the garage to change a light bulb, fell off his ladder, broke his rib, and while they were x-raying him for the broken rib, they found out he had lung cancer, and so they took out the cancer in his lung and a couple lymph nodes, and now he's cancer-free too. So looks like both of you guys beat cancer at the same time.
Yay, I beat cancer!
I know. So, amen for that. All right, buddy. Well, unless you got anything else to say, we're going to wrap this up.
As far as I know, I don't know if it's going to be the same for you, so just try not to panic and trust my word that it's not as bad as it seems, because I don't know what kind of cancer you guys have.
Let's see. So this is a week after your last chemo treatment.
Yeah.
How you feeling?
As of right now, I'm feeling fine. Other than the fact that I'm kind of cold.
A little cold?
Yeah. But that's about it, as far as I know.
Your hair's coming back already.
Yeah. They said that it would grow back in a couple of months.
You still got a couple of stragglers on from the very beginning. I think they're in the back. Turn your head. You can barely see them if you can at all. They didn't, like, you got like 5 hair that didn't fall out.
Yeah. The chemo makes you lose all your hair.
How do you feel?
I feel fine right now.
How's your coughing doing?
Actually, it's not that big of a problem when I adapt to it.
Well, I think you're still on, or you just got off the steroids they gave you, which kind of hold that coughing at bay too, doesn't it?
Yeah, I think the steroids that they give me like prevent the coughing a bit, but it doesn't actually like stop it altogether. You know what I'm saying?
Yeah, I'm just saying, in another week or so, you might start coughing a little bit more than you normally have, but
yeah, but so far I haven't been coughing a lot.
With this last treatment.
Yeah. I mean, usually I just get a bunch of popsicles.
Yeah.
Yay! Bunch of popsicles.
I know, you're getting popsicles out of this, so there's no too bad complaints there. Okay, so you're feeling okay now?
Yeah.
Okay. Is there anything you'd like to say to anybody that, is getting ready to have chemo, and they, of course, like you, never gone through it before, and you were kind of scared at the beginning?
Yeah, I was scared because I wasn't really sure how this was going to work out. I'm like, are they going to inject poison into me? And turns out it's gonna be fine. You're gonna be fine. The only problem is it's different for everybody else, so I don't exactly know what the side effects are going to be for you. But you shouldn't have that much of a problem with it, as far as I know.
Now, what about the surgery?
The surgery?
The one you're getting ready to have.
What surgery is that again?
Yeah, the one to make you not look so damn ugly.
Really? You're gonna go back to that?
What are you talking about, buddy? I never left that.
I don't think I was having a surgery not to make me ugly, you turd.
You stop laughing and I'll stop doing it.
Okay, which will probably be never.
I know. I'm an attention whore. What can I say? So yeah, the treatment may be different for everybody else that's going through this, but your experience with it, you were scared and you had a reaction actually. Every time you had chemotherapy, you had a reaction to the chemo drugs, and they had to put you on a lot of Benadryl.
Yeah, they had to put me on a lot of Benadryl because every time I had that stuff going through my body, I would have an allergic reaction, and I would feel like my stomach wouldn't feel right, and then I would start coughing and throwing up.
Yep. It hurt your stomach. You said it hurt your stomach? Like, what was it?
It made me feel very uncomfortable, and then I started coughing and gagging.
Okay.
And I don't exactly know why it does that, but I just have a bad side effect to it, I guess.
You have, you've had allergic reaction to other drugs before, too. You had the drug that they put you on when you had your Broviac line. Trying to remember, what was that? Began with an A, I think.
Honestly, I don't know if I remember that. Probably when I was, like, younger. A lot younger. Was it?
Vancomycin.
What's vancomycin again?
It's an antibiotic.
Oh.
I think you're allergic to vancomycin. You get they call it red man syndrome, where your body turns bright red, and they have to give you Benadryl for that, and that's what they would use to fight your line infections.
Right.
A lot. And then you were allergic to tobramycin, so you've got some drugs that you're allergic to. So some people may not be allergic to this at all, and even when they did, they stopped your IV almost immediately, and the symptoms went away.
30 minutes probably after.
It was a little quicker than that. Like within 5 minutes, all your symptoms, your allergic reaction went away because you were already on Benadryl.
True.
And then they gave you a little bit more Benadryl, and then you were fine.
Yeah.
So, first time we did it, it was what? 9 o'clock in the morning, I think, till it was 12 hours, I think.
Yeah, I think so.
The first time we did it.
Yeah, the first time you and me and Mom were there, and we were sitting in the room for 12 hours.
For 12 hours. We were in there so long, we watched the movie Hocus Pocus. Remember that? The whole thing.
The whole Hocus Pocus movie.
It was snowing when we got out, remember?
Oh yeah, and Mom slipped on her butt.
She did right out in front of the hotel when we were getting our stuff and we were checking out so we could try to get home before it got too bad snowing, because it was supposed to snow really bad the next couple of days.
Yeah, and then she crashed.
Yep, she landed on her butt. It's all right though. She's all right. You're right. So it's been a long road, man. It's been, let's see, it's the 5th month. You started your surgery like a week before Christmas to have the tumor and part of your intestines removed.
I had the tumor that was in the hospital until like, what, Christmas Eve?
You were there. You got out December 24th. That morning, me and your sister came and got you and your mom, and we drove you home, and you had Christmas at home.
Hey.
I know, right?
I was so happy to be home for Christmas.
I know. We were all happy you were home for Christmas.
That was like my favorite thing.
Mm-hmm. Yay! So you perked up pretty quick after you got home, and
Yeah.
you've been chugging along ever since.
Yeah. Unfortunately, I don't think my body is doing so well with this smaller intestine, because now it's making it harder for me to digest my food and stuff.
Oh yeah?
Yeah. Like, I think sometimes I've been stewing out a lot more than I think I have,
I don't think you have.
but I don't know.
I don't think you have.
Really?
Yeah, because I think you're confused. I think you're confused between farting and diarrhea. Pretty sure you didn't have diarrhea. You had gas.
Nah.
But that's okay. I mean, not for us.
Not for you. you guys, but...
Thought you were going to kill most of the animals. That poor dog, he'll never get the fur back. But at any rate, we move on. We move on. The thing is, that was your last chemo. You got to check up in 3 months to see how everything's doing, and you're fine.
Yeah, as far as I know, they're not going to let me do any more chemo unless it comes back again.
Yep.
So, that'll be a yay for me!
I know, right? All right, man. Well, I think we've taken enough time, and I appreciate it. Thank you for making this video with me, and, you know, let's hope that it helps people out there that may be getting ready to go through chemo and are afraid. Like you said, not everybody's chemo is the same. You know, it's tailor-made to the person, so it may be different for every person. But if this helps somebody be a little less afraid, then...
And yay for them and yay for us.
Exactly. All right, buddy, thanks.
You're welcome.